Checking for infections. Men and women can contract and spread sexually transmitted infections. They do this through unprotected vaginal, anal, or oral sex, or just close genital contact with male or female partners. Some STIs can be transmitted via infected blood, saliva, or from mother to baby. STIs may produce no symptoms, so it is sensible to have an STI check before starting a sexual relationship to reduce the risk of infecting others. Some viral infections can be detected by blood tests. At the time of infection, HIV may cause a flu-like illness, but 1 in 5 people develop no symptoms. HIV is detected with a blood test for antibodies raised by the body against the virus. Antibodies can take 3 months to multiply sufficiently to give a positive result. So the best HIV tests look for antigens, traces of the virus itself as well, which can be detected 4 weeks after infection. If using point-of-care testing at a sexual health clinic, for instance, results can be produced from a pinprick blood sample on site within a few minutes. In some clinics, you might be asked to provide saliva. A second test to confirm the results is strongly recommended. Hepatitis C is also often asymptomatic. Blood tests look for antibodies, but in this case, antibodies can only show that the body has been exposed to the virus. It may since have fought the virus off. To confirm you are infected and infectious, more precise tests are needed that detect the viral RNA, the genetic material. More than 1 million sexually transmitted infections are acquired every day worldwide. If you suspect you have an STI, a clinician will ask you about your sexual history as part of the testing procedure. You might be asked when you last had sex and if you used a condom. So the viral infections are HIV, hepatitis B, C, genital warts, genital herpes, while bacterial would be syphilis, gonorrhea, chlamydia, non-gonococcal urethritis, and we have trichomoniasis, which is a protozoan parasite, and pubic lice, which is an animal parasite. All of these infections, the viral and bacterial, can produce symptoms in some cases, but any of them can also be completely asymptomatic, particularly in the early stages. Bacterial infections, such as chlamydia and gonorrhea, can be detected in urine or in swabs from the urethra. In the case of urine, you will be asked to wait for at least 2 hours since you last urinated before passing a urine sample. The first part of the urine stream should be caught in a sterile container. This is because by the end of urination, vital telltale bacteria might have been washed away. The urethral swab test. The healthcare professional may want to take a swab. A small cotton-tipped swab is inserted directly into the urethra to collect any bacteria there. A swab can also be used to collect a specimen from your anus, throat, or eyes. Home testing and home sampling HIV kits are available and legal in some countries. Most of them use a pinprick blood sample and/or a urine sample. You can sometimes do postal testing too. Discuss with your doctor having the hepatitis B vaccine and practice safer sex. Thank you for your attention.